Hello again, mga listeners. We will have to continue our discussion, especially about your fluoroquinolones as one of the classes, major classes of antibiotics. What are fluoroquinolones, by the way? They are relatively new class of antibiotics made synthetically and are associated with mild adverse reaction. Also, take note that your fluoroquinolones are bactericidal and they are broad spectrum also. It means to say, when we say broad spectrum, they're also effective among wider forms of bacteria that can be either gram negative or a gram positive form. Actually, we have an original quinolones discovered before. We have your nalic acid and your sinoxacin. Um, for further discussion about how fluoroquinolones were made, it is because there is an additional fluoride atoms that being added to their molecular structure. That is why there is term fluoro plus quinolones because of the presence of your fluoride atoms. Actually, this is to create a newer drugs, and to increase also the antibacterial potency and spectra. So, what are the examples of your fluoroquinolones? Actually, they have a fluoxacin in their names. We have, for example, fluoxacin, and they come into varieties of generic, brand name. We have a brand name of Noroxin, and we have also your Cipro. Cipro is one of the common example of your fluoroquinolone, your ciprofloxacin, with a brand name of Ciprobay. You have also your fluoxacin, pefloxacin, moxifloxacin, levofloxacin, and your lomifloxacin and gemifloxacin. Okay, as a nurse, we must be aware that there are some potential side effects. We have, for example, your tendinitis or tendon rupture. If you heard about tendinitis, there's something to do with your tendons. Actually, your tendons is one of the connective tissue in our body that connects from muscle to bone. Okay, as a nurse, um, we must be aware about this kind of side effects, especially to kids under 18 years old and adults over 60 years of age. And also watch out for severe infection in the bowel or in our gut caused by the Clostridium difficile. And also extra precaution um, with the use of your fluoroquinolones among pregnant clients because it may have a potential harm to the developing fetus. And when there is a potential harm, it might be teratogenic. It may possess teratogenicity. And also watch out for photosensitivity and no milk products, iron, zinc, salt, magnesium, and aluminum antacids. It is because they decrease the absorption rate of the fluoroquinolones. It means to say, it is one of the interactions of your fluoroquinolones among these several classes of drugs and products or substances. Actually, if you're taking aluminum antacid, so the timing must be 6 hours before and 2 hours after ingestion. And in some other authors of your pharmacology, it is said to be that if this drug combination is necessary, the administration of the two agents should be again the administration of the two agents should be separated by at least 4 hours. But it depends also with the other substances that may possess also drug to drug interaction. Like for example, your antacid, as I mentioned, 6 hours before and 2 hours after ingestion. So what are the indications of your fluoroquinolones, by the way? Actually, they can knock out the UTIs. As you can see, the image here, they're given to conditions like your UTI, urinary tract infections, or any infection affecting your urinary tract. and also for upper respiratory tract infection and other condition that affect your GI system and your soft tissue infections. And as a nurse, if you infused the fluoroquinolones, for example, your ciprofloxacin, because ciprofloxacin can also be given via IV. It has also in oral and topical forms of your ciprofloxacin, and your ciprofloxacin must be infused over 60 minutes because it is very irritating to the veins, which causes much pain among those patients. Take note also that your ciprofloxacin, it was approved for the prevention also for the anthrax infection in areas that might be exposed to germ warfare, and it is also effective among patients with typhoid fever. And some of your fluoroquinolones can be given with community acquired pneumonia, bronchitis, and other severe type of infections. By the way, what is the mechanism of action of your fluoroquinolones? Okay, your fluoroquinolones, actually, it interferes with the action of the DNA enzymes necessary for the growth and reproduction of the bacteria. And this leads to the cell death because the bacterial DNA is damaged and the cell cannot be maintained. So that is the mechanism of how it leads to bacterial cell death. So by means of inhibition to some certain forms of DNA enzymes needed for replication or reproduction, which in turn, because of that, the bacteria can be compromised. They can eventually leads into, again, bacterial cell death. What are also serious adverse effects aside from the side effects I mentioned? Actually, the most common are headache, dizziness, insomnia, and depression, which are all related to the CNS effects. And also, it has also a GI adverse effects. We have your nausea, vomiting, diarrhea, and dry mouth. Caution should be used also in the presence of renal dysfunction, or it means to say if you have problems in your kidney. It is because it can interfere with the drug excretion, and also in cases like your seizures, which could be exacerbated by the drug's effect on the cell membrane channel. So take note for that. And as one of the side effects of your fluoroquinolones, I think I have given you some important points about the fluoroquinolones. So that's all, and watch out for my next video.